Hello, Medicare Adventures! Thank you so much for joining me today on this next step and leg of our journey together. Today, we are going to talk about different chronic conditions. Now, yesterday, I alluded to this particular segment of our journey, and so there are actually 21 qualifying chronic conditions that an insurance carrier could have a plan for in your area. Not all of them have to have a plan in your area, but any of these could have a plan in your area. So let's go ahead and get started, as there are 21 of them, and so there's lots to be able to review, although we will be touching on each one only briefly. So to start out, here we go at our first list here. We're going to start out with alcohol abuse. Okay, and again, these chronic plans have benefits and services that are designed to be able to complement and to be able to assist the Medicare beneficiary or the Medicare Adventure in overcoming or increasing the quality of life that they have with that chronic condition. So we have alcohol abuse, we have Alzheimer's disease and related dementia. We have arthritis, both rheumatoid and osteoarthritis. We have asthma, also atrial fibrillation, which is usually heart palpitations. We have the autism spectrum disorders, cancer, specifically breast, colorectal, lung, and prostate. We also have chronic kidney disease, chronic obstructive pulmonary disease, depression, as well as diabetes. Now, this is obviously not 21. We still have some more. But I want to take just a short break as we go over these. Just a little tidbit or a fact about these chronic conditions. Keep in mind that if there is a plan in your area that does have a plan for your particular chronic condition, you do have to have your primary care physician, or if you do not have a primary care physician, you have to have a physician stating to the insurance company that you do have that chronic condition. If for some reason you are not able to provide, or the insurance company is not able to get confirmation from a doctor regarding your chronic condition, confirmation of it, then what will happen is that you will be disenrolled from the plan and you will have to enroll in the plan that you were in before. All right, let us go ahead and continue on our next set of chronic conditions, the remainder. We also have drug abuse or substance abuse, also heart failure, hepatitis, such as chronic viral B and C. There is also HIV and AIDS. There is also hyperlipidemia, which is high cholesterol for the rest of us. Then there is also hypertension, which is high blood pressure. Then it is ischemic heart disease, and then osteoporosis, and then schizophrenia and other psychotic disorders. And then last but not least, we have strokes. So these are all the different chronic conditions that could be covered or have a specific plan in your area as a Medicare Advantage plan. Keep in mind also, as another tidbit with chronic conditions, these chronic condition plans, or these chronic special needs plans, as they are formally called, usually are HMO plans in nature, or in structure, I should say. Also, these plans will have medication coverage or Part D coverage built in to the plan itself. Because for many, if not all of these different chronic conditions, there are special medications that are needed to be able to help treat the specific chronic condition that is there. Now, you may ask, so I have one of these chronic conditions and there's a plan in my area that covers this chronic condition. For example, if you are a diabetic and you are here in Maricopa County, there are actually a couple of different plans that would cover you specifically. How can I take advantage of this? When can I enroll? Do I have to wait until the annual enrollment period? Well, the government has you covered on this one. So if you have one of these chronic conditions, you are eligible for a special election period, or an SEP, as normally called. You have a special election period once a year to enroll specifically in this plan, or the plan that has your chronic condition. So it doesn't mean that just because you have diabetes in Maricopa County, you can enroll in any plan that you would want to using that special election period. Using that special election period, you must enroll in a chronic special needs plan to be able to take advantage of that option to change. So that kind of wraps up our what are the chronic conditions related with Medicare. I appreciate the time that you have spent with me today on this leg of our journey together. I look forward to continued adventures as we continue to clarify and get the brush out of the way, and we can see much more far off our journey together. Until next time, stay safe, and if you need any help with your Medicare questions or other needs, please do not hesitate to give me a call or reach out to me, whether through Facebook or you can leave a comment below on YouTube. I look forward to assisting you in every leg of your journey, and until next time, take care.